Welcome back. This is Chapter 2, Relationship Quality, Establishing and Maintaining Rapport. As I mentioned before, relationship quality has four components: rapport building, demonstrating empathy, instilling confidence, and appropriate nonverbal communication. To establish rapport right from the start, what you need to think about doing is first introduce yourselves appropriately to the patient by using your full name. I would avoid using just your first name, and you might also want to introduce yourselves as student physician and whatever your last name is. And you also want to find out what the patient's name is and how they would like to be addressed. It's important to set an agenda. You can do this after the introduction by telling the patient what you would like to do. It's also important that you get an idea from the patient what's on their mind. So, for example, patient may be coming in for something, but it could mask what the real issue is. So it's important to find out as soon as possible all the issues on the patient's agenda, because it becomes a time management issue. You want to demonstrate a collaborative approach to the patient, and the patients will be looking for some statements such as, let's work on this together, we want to work together as a team to try to come up with a solution to this problem, and so forth. So it's an effort on your part to not just take a unilateral approach to patients, but also to include the patient in on the problem solving of whatever the issue is. It's important that you're friendly and show that you like the patient if you do, and be hygienic. Wash your hands before touching the patient, especially to wash hands before the physical examination and afterwards, and to wear a clean white coat. Nothing turns a patient off than seeing a medical student or a doctor with a dirty white coat. It's important to not show that you're irritated or angry with the patient, and some of the patients will provoke you. That's just the way it is sometimes, but it's important that you maintain a professional demeanor at all times. And the opposite, of course, of being sanitary is having dirty hands. And sometimes I have seen medical students who look like they've been working in their garden all weekend or working on their car, and you need to pay attention to your cleanliness at all times, especially in this age of infectious disease consciousness. One sensitive issue that comes up is body odor. That some medical students or residents may not wear deodorant, and this becomes an issue, and sometimes the patients will tell you if this is a problem. They'll give you feedback on this. And equally bad are students or physicians who come in with strong perfumes or scents, and so you want to avoid both of those because these are sources of irritation and distraction to the patient.